Why do most people stay trapped in anxiety, stress, and bad habits, even though they desperately want to change?
Well, uh, I think sometimes it's because they approach the problem backwards. Um, Anxiety makes you feel bad. You're worried. You don't sleep well. You feel tension. And the way you know you're anxious is the way your body's reacting to the anxiety. Your muscles tighten. You break into a sweat. Your heart rate goes up. You breathe rapidly and shallowly. And then you think, oh my God, this must be really bad because I'm feeling so terrible. And you feel worse. It's what I call the snowball effect. It just keeps building. And so what I try to do is help people from the body up rather than from the head down. Find ways that you can calm and control how your body's feeling so that you can then think more clearly about how to solve the problem. And hypnosis is a very helpful way of doing that.
Yeah, I'd love to dive into hypnosis because I think over the years, people's understanding of hypnosis is like the ticking clock that you kind of swing back and forth. And I know your work is obviously completely different from that. Explain from a psychiatric and medical definition, like what is hypnosis and how can it help things like anxiety and stress?
Sure. Hypnosis is just a state of highly focused attention. It's like the other experience. Have you ever had the experience, Doug, of getting so caught up in a good movie that you forget you're watching a movie and you just enter the imagined world, become part of the movie? Now,
It's one of the best feelings.
it is. It's great. So that capacity to highly focus your attention and immerse yourself in something is a naturally occurring ability. Some people can do it better than others. Some can do it more intensely than others. But that ability is at the core of hypnosis, highly focused attention. And to do that, you dissociate. You put outside of conscious awareness things that would ordinarily be in consciousness. So right now you're sitting in a probably marginally comfortable chair in your office there, and you have sensations in parts of your body touching the chair, but hopefully you are not even aware of them until I mentioned that. Is that right?
That's correct.
If it weren't correct, we'd better stop the interview now. You're bored already. But that so our brains do that all the time, but we don't take control of and utilize that ability to focus intently, put outside of conscious awareness things that would ordinarily be in consciousness. And the third thing that you can do in hypnosis that helps with anxiety is you can try out being different. You can see what it's like to suspend your usual beliefs about who you are and what you have to be. And part of the problem with anxiety is that you feel stuck. You just think, I'm in this, I've been in this many times before. There must be something wrong with me. I can't get out of it. I can't figure my way out of it. I don't know what to do. And then, of course, you feel more anxious and on it goes. If you can suspend your normal assumptions about who you are, which you do in hypnosis, you can try out being different and see what it feels like to be somebody who could view the tension as an opportunity to change, to do something different, to improve a problem. The anxiety is like a warning signal. It's like that, repair signal on your car. The light's flashing, you better do something. And it's annoying and troubling at the time, but it gets you to keep things from getting worse. And so in that sense, if you can learn to see anxiety as an opportunity to do something better, you can control the anxiety, and you can do it by starting with making your body more comfortable and putting yourself in a better position to solve the problem.
And do you think one of the biggest mistakes people make when it comes to managing anxiety is this hyper focus on the anxiety and the sensations themselves and not on the solution or how they can, move forward?
That's exactly right. The anxiety becomes the problem, and getting rid of the anxiety is what you think you have to do rather than deal with the problem, and the anxiety will take care of itself.
And when it comes to like getting into a hypnotic state, well, the thing with anxiety that in my experience, it's so tough when you're in this state of chaos and intense panic. What tends to happen is those sensations are so overwhelming. The thought of calming your body down becomes so overwhelming and daunting. How can somebody, when they're in this state of panic, create some sense of peace within their body to like begin to work through some of that stuff?
Well, your question is a very good one, but the issue here is practicing doing things like this at times when you're not at your peak of anxiety. So we build Reverie, the hypnosis app, to teach people to practice controlling their stress at a time when they're able and ready to practice, and then be able to apply it when some difficult situation comes up. So, and also if you know when there are situations that are going to make you anxious, practice preparing for them and doing it while the anxiety is getting worse, rather than waiting until it's a disaster and then you have more trouble controlling anything.
What's the minimum effective dose of something like hypnosis that has been scientifically proven to work? Is it a minute, 5 minutes?
You can do it in under a minute. And we have evidence from tens of thousands of people who've used Reverie that within 10 minutes, they feel a significant reduction in their anxiety, like 15% lower. Just learning to do the self-hypnosis. It doesn't, you can do it quickly and easily once you've learned to do it.
And what does that process look like? Like walk me through a hypnosis practice that
Or you want me to do it with you or just describe it? I'll do whatever you like. The cat wants to be hypnotized. I can see.
my cat wants to be hypnotized too. Yeah, I would just describe the process of hypnosis. I think that would be the easiest.
I mean, there are many ways, but the thing I have used with thousands of people is to just, on 1, do one thing, look up. On 2, do 2 things, slowly close your eyes and take a deep breath. And on 3, do 3 things, let the breath out, let your eyes relax, but keep them closed, let your body float. And then let one hand or the other float up in the air like a balloon. That's your signal to yourself that you're ready to concentrate. And that's it. People have the ability, they can go into a hypnotic state just like that.
And then is it like working a muscle where you have to practice that routine longer in order to train your brain to get better at it?
Well, I used to think that, but in fact, hypnotizability, the capacity to trace hypnosis, is a very stable trait, and it doesn't change very much at all over time. So what you can do is learn different types of hypnotic exercises for different types of problems. So you would think, then use the hypnosis, if you're dealing with pain, for example, to imagine you're in a warm bath. The warmth is filtering the hurt out of the pain. If you want to deal with stopping smoking, you focus on the thought of respecting and protecting your body. You don't think about not smoking, you think about being a good parent to your own body and not putting into your own lungs, your body's lungs, what you would never put into your baby's lungs. And so it depends on what you focus on, what you think about. That can vary with the problem you're trying to solve. But once you're in the hypnotic state, you can do it rapidly and intensely.
One of the problems I think people face when it comes to revamping their relationship with anxiety is the fact that they've had this unhealthy relationship for so long, and they have had negative thoughts and conditioned their brain to act and think a certain way. How effective is something like hypnosis at stopping that? Like, how long would it take for somebody who's had quote unquote anxiety for like 10 years? How long would it take for a hypnosis to fix that?
They could learn to use self-hypnosis very quickly if they're hypnotizable, and they practice it regularly and do it, several times a day. And anytime they start to feel that anxiety coming along, it can happen very quickly. In minutes or in a day or two, they can learn to get the hang of controlling.
Your work's been around for a while, and like you've said, you've helped tens upon tens of thousands of people, help with their anxiety and stress and stuff like that. But yet hypnosis hasn't been talked about as much as things like cognitive behavioral therapy, meditation, traditional therapy, breath work when it comes to anxiety. Like, why has hypnosis not gotten the attention that some of these other modalities have?
Yeah, well, you remember Rodney Dangerfield? He was a comedian, said, "I don't get no respect." They
Caddyshack, one of the greatest movies ever.
tagline, right? He said they asked me to leave a bar so they could start at the hour, that kind of thing. I don't understand it. Hypnosis, Doug, is the oldest Western conception of psychotherapy. It's been around for 250 years. Now, part of it is, the stage show things where you get the football coach to dance like a ballerina and people think they'll make a fool of me. But the big concern that is also actually the biggest opportunity, Doug, is that people are afraid that they will lose control when they hypnosis. That somebody will take over and make them do things they don't want to do and all that. And if you're willing to suspend your evaluation of who you are and try out being different, you're also taking a bit of a chance that you might turn into someone different that you don't particularly like, or that someone else is telling you to be. We're social creatures. We're susceptible of social influence. But with hypnosis, you can kind of free yourself up to see what it would be like to be different. And some people find that frightening. I see it as an enhancement of control. You have more opportunities to be different, to be better, using hypnosis than you would without it if you're willing to give it a try.
What have you found to be happening during in the brain during things like stress, anxiety, or trauma, and why does it feel like people are so out of control when they're experiencing those things?
Well, they're having uncovered. Well, part of it with trauma in particular is the experience of trauma is the experience of being made into an object, the thing. You lose control over what's happening in your body. Agency is gone, and that's a very unpleasant experience. And when you relive it, even with or without hypnosis, you sometimes re-experience that sense of losing control. But what you can see over time is that you learn to approach a troubling experience from a different point of view. And the same is true with anxiety. You can say, I don't have to feel hot and sweaty and breathless. I can face the problem I need to face without feeling that I'm out of control of my body. And what you do there is you use hypnosis to get your body comfortable first, and then figure out, once you've done that, how to deal with the problem at hand. So I have people imagine they're floating in a bath, a lake, a hot tub, or floating in space, body comfortable. Breathe in quickly and slowly exhale through your mouth. And then, now that you're feeling more comfortable, picture on an imaginary screen the problem you're dealing with on one side, but keep your body comfortable. And on the other side of the screen, make it your brainstorming screen and figure out what's one thing I can do about that problem. So you start out with the one thing you actually can control, which is how your body's feeling. And then you apply that to the problem that you may not be able to control, but figuring out ways of trying to control what's troubling. And that's how hypnosis can help.
What you're talking about seems, a bit different, I guess, from what people have said anxiety is over the years. People have classified anxiety as being this disorder and disease of the brain, right? That's impacting, and you got to focus on the mind, and that's what you have to address. But I'm hearing you say, like, it's the body that you have to focus on, because if you get the body right, then that will make the mind improve as well. Like, what have people gotten wrong about anxiety and what truly causes it?
Well, there's no question that it's a brain problem too. It's a matter of how do you experience it and what's the most effective way of dealing with it. So what I'm saying is, get your brain to do things that will have the effect of reducing your anxiety, but start with making your body more comfortable. And what happens in the brain when you use hypnosis is you turn down activity in the dorsal part of the anterior cingulate cortex. It's like a C on its ends in the middle of your brain. And that part of the brain is what we call part of the salience network, part of the brain that is an alarm system. You hear a loud noise, change your attention. That's your dorsal anterior cingulate saying, you got a problem, you better check it out. So you can turn down activity. When people go into hypnosis, we've done functional magnetic resonance imaging on the brains of people going into hypnosis, and they substantially reduced activity in the alarm system in the brain. So you're basically saying, just turn down the volume on your alarm system, and that will allow you to think more clearly about what's going on. You can inhibit activity in the amygdala, which is the fear and anger region at the base of the brain in the limbic system. And you can turn down activity as well in the back of the brain, the posterior cingulate cortex, which is part of our default mode network. It's what we think of who we are, what we are. And the default mode can be very helpful when you're trying to just figure out what you should do and thinking about who am I, what do I want to be, what did my parents raise me to be? But sometimes it constrains you. It tells you you're not good at this, and you're just going to get hurt again, and you won't be able to deal with it. And if you can turn that noise down, you can see what it would be like if you were different. And so that's where hypnosis can enhance your ability to be different.
I think a lot of people get a lot of anxiety because of their thoughts around their reality. And sometimes when people look at their situation objectively, the reality isn't as bad as that person might think in that moment. Do you think that more anxiety is created from the thoughts around the situation, or do you think it's actually created because someone is genuinely scared or fearful about their situation?
Well, they may be fearful, but you're absolutely right. The way you think about it can make it worse. One thing people use hypnosis are fond of saying is the worst thing you can do is tell someone not to think about purple elephants. That's what you'll be thinking about. And so people being afraid of something, what they're queuing up is what they're afraid of, not what they're doing to overcome it or what they could do to overcome it. And, in your very touching history of how you got to be where you are now, you felt, if I may bring that up, that, your life was over and you had reason to share that when you got arrested, wound up in jail. And unfortunately had a very kind, smart cellmate who taught you to think of it as a challenge and an opportunity to make yourself different, to be different. And that's what you did. Started working out, decided how you could change your life, and you did. And so you were taking things that very reasonably should make you anxious as hell and see it as an opportunity to start being different. And that's what you did.
Well, I appreciate the kind words and for doing some research on my story. That really does mean a lot. And I think the takeaway from that and what you've been sharing is, I remember in my journey early on, what got me moving forward was thinking about the person that I could become if I continued with these habits, because whatever I was doing before wasn't working. Is that the theme of what you've been mentioning? I've heard you hint at this, is that you have to think about that, this new version of yourself that you want to become, and that's what's going to lead to that person being able to transform their life.
That's absolutely right. Focus on what you're for, and that's what you were doing. You went through a period where you were feeling miserable about who you were and what you had done. But you got to turn around and say, well, here's what I want to be. Let's see if I can be it. And that, the best way to change human behavior, Doug, is intermittent positive reinforcement. And if your attempt to deal with anxiety, God, I really shouldn't worry about this. I won't think about the plane crashing. That's what you think about. Instead, you focus on your floating with the plane. The plane is being an extension of your body, and the pilot an extension of your mind. You're focusing on what's positive about what you're going through, and you can feel a way out of it. And that's what you can do with it.
And I think it comes back to this idea that I learned years ago when it comes to anxiety, is like just being able to ride the wave. And I think what happens with people when it comes to anxiety is they want to fight the wave. They want to run from the wave. But I think if you can just ride it and just know that anxiety is going to come and go, life's going to have ups and downs. That's just the unfortunate reality of life. If you can just navigate that and learn how to accept it, I think you'll just develop that muscle over time to be able to deal with hardship, adversity, and anxiety as it comes along.
Well, that's right. And actually, one of our exercises involves using that phrase, ride the wave. That's what a good surfer does. When he gets knocked around by it, he rides it. He takes the force of it and goes where he wants to go. And so you're exactly right. And the more you do it, the more you get confident in your ability to focus the way you want to focus and focus on what you want, not on what you're afraid of. You're able to do it. I had a businesswoman came to see me because she had a dog phobia, and she was a very effective. She was a CEO of a company. She was tough, but boy, the dog comes in and I said, what do you do? And she said, Well, I freeze. I just stop and look at what the dog is going to do, and see what he'll do. And I say, look, if you had a difficult employee come in your office, would you just freeze and wait to see what the employee would do? He said, hell no, I'd tell him what. And I said, exactly. So that's what you want to do. And she got over her dog phobia. She just focused on dogs can be, if some dogs are dangerous, most of them aren't. The dog can be a friend. And I can learn to get the dog to do what I wanted to. And he was fine. So it's a matter of focusing on what you're for. And the anxiety is a signal, but in an odd way, if you make it the problem, you make it harder to solve it.
Yeah, and you end up like not wanting to do anything. I remember a time where I was knee deep in panic and like I would just justify not doing certain things because of the anxiety. And I found myself being like, wait a second, am I just going to sit at home and not go out? Like I can't do that. And that was one of the things that helped me was that, what did I want? Did I want to be miserable for a short period of time in the midst of that anxiety and work through it, or miserable for a long time just sitting at home and knowing that I was essentially watching potentially myself deteriorate from not going out and doing things that, quote unquote, scared me at the time. When I hear you talk about hypnosis, things like mindfulness and meditation also come to mind. What's the difference between hypnosis and things like mindfulness and meditation?
Hypnosis is about doing, and mindfulness is about being. In mindfulness, and I have great respect for that. It comes from a very long, wonderful tradition, and many people feel better. But it is different in that you're just supposed to be open to feelings and thoughts and let them flow through you. Now that can help with anxiety in the sense of not fighting it, but you're also not doing anything to reduce it necessarily. You're just observing how you're feeling. And you have a body scan, which people will do when they're anxious anyway. They'll check out different parts of your body. And you try to cultivate compassion and meditate. Those are all good things. But hypnosis is more focused on an intentional way of solving a problem. I had a woman who was a 10-year meditator, twice a day, 10 years. And she said, I think it's great, but I still have migraine headaches. They're driving me crazy. And I said, okay, so let's do some hypnosis. And I had her imagine an ice cap on her head, cool tingling numbness, because people with migraine often have vasodilatation in their scalp and they feel uncomfortably hot-headed. And so she practiced the ice cap on her head. And she called me a week later and she said, Doctor, thank you. My migraines are gone. And I want to thank you for freeing me to use my intentionality. Because with meditation, you're not supposed to, the whole idea is not to be intentional, to just observe your experience. And with hypnosis, you're there to control it, to manage it, focus it on what you're for, and use it to solve a problem.
You're talking about like using hypnosis to help with anxiety and fear and things like that. Have you seen that if you consistently practice hypnosis, does it like completely change your nervous system and how you view things like fear over time?
Yeah, I've seen a lot of people who get over their phobias, who, get on an airplane and be fine, or who don't worry about dogs. I, my father was a psychiatrist who also used hypnosis, and he had a patient who we practiced in New York, and he had a patient who had a horrible dog phobia. She and at a fancy dinner party her husband had arranged, a woman came in with a cute little poodle, and she jumped up and knocked over the table on everybody. And he said, "Get fixed or we're done." So she saw my father, and he was quite hypnotizable. Had her have a friend who she trusted, who had a dog, bring the dog closer and closer to her, and she in hypnosis would think about how a dog could be a friend, not an enemy. It could help you. And she started thinking, okay, dog friend, and she felt better. And about 6 months later, my father called to see how she was doing. And he got a little boy on the phone. And the boy said, well, who's calling, please? And he said, well, Dr. Spiegel. And the boy said, well, that's funny. And he said, what's funny? The boy said, Spiegel's in eat. So the woman had gotten herself a dog and named it Spiegel. So she had clearly conquered her dog phobia.
That's awesome. Um, I'm curious, like, how have you been able to help people use hypnosis to work on things like limiting beliefs? Like, one of the common things I've heard over the years from people is, I'm not enough, I'm not good enough, I don't have confidence. Like, how can hypnosis help improve somebody's self-esteem, the way they see themselves?
Well, part of it is learning the distinction between what you are and what you feel. And that's that default mode network. It's that part of your brain that kind of helps you define who you are and what people think of you. And in hypnosis, what you get people to do is to focus on what you're for. Picture, well, this is what I'm worried about, but could I picture how I could do something that I've been unable to do? And what are the steps I could take that would get me there? That would allow me to prove to myself that I can. And you do that, again, by keeping your body calmer. So you start out by mastering your sense of anxious arousal. And as you do that, picture approaching one of the problems that you thought you couldn't deal with, and picture a way that you think you can deal with. So, if you're procrastinating about writing, you have to write something, picture yourself, prepare yourself, get your body comfortable, picture yourself sitting down at your desk, opening your laptop and writing for half an hour, 10 minutes or whatever it is. And just picture how good you'll feel when you've been able to do that. So you do it a bit at a time, and you picture keeping your body comfortable and happy while you put aside your assumption that you just can't do it, because you wind up proving you can't do it. And instead, say, I'm going to feel really good. I'm going to give myself a reward by, write 3 pages and then go ahead and do it.
What are some habits that you recommend to people other than hypnosis that help with their mental health and capacity to deal with anxiety throughout the course of the week?
Well, I think part of it is, um, thinking about having challenges or plans that aren't instant losers, but aren't things that are so big that they overwhelm you and you just can't deal with it. So make it a bite-sized problem that you can do something about, and have the experience of doing it. And then maybe it'll be a bigger bite next time. But cognitively, if you structure it so that you're not destined to fail, you're more likely to succeed. Or judge your challenges in a way that you're able to do it.
There's been a lot of talk, over the last few years about things like sleep, exercise, alcohol, caffeine, and how they impact anxiety. Any thoughts around those things and some other things that people should or shouldn't do, like throughout the week, that can help with that?
Well, all of the usual or habits can make a big difference. Exercise is good because when you're running, for example, your physiological arousal more closely matches your mental arousal. But you're not just feeling physically aroused without having any thought of what is making you anxious, that making you over aroused. So just building up your body's capacity to handle physiological arousal is a good thing to do. And, many people talk about the runner's high, you feel good when you're aroused. But if you had that same level of arousal, heartbeat, sweating, high blood pressure, higher blood pressure, when you weren't running, you think, oh my God, something's going wrong in my body. You can have a state of normal arousal. Sleep is very important. Just can't handle stress well. You can't handle problems well if you haven't had enough sleep. And we all need usually 7, 8 hours of sleep a night. And we often don't get it. And if you've had a bad night's sleep, you're not fun to be with. So taking care of your body, feeding it food that is good for it, too much, all of those things that make you a good parent to your own body will also reduce your anxiety and help you deal with your anxiety.
A big problem with people and their anxiety, and specifically talking about habits, is that they're used to numbing the pain with things like substances, drugs, money, like you name it. And when you ask them to give that up and in place of the things we've been talking about, it's hard because they've had this thing that is so powerful that's been numbing them in seconds. How can people not do that? Like, how can they convince themselves that don't have to numb the pain anymore and they can lean into things like hypnosis and some other practices we've been talking about?
Well, the nice thing about hypnosis is that it doesn't cost anything. Access is easy right wherever you have or plus is professional. And and the trouble with numbing the pain is you kind of numb everything. You kind of reduce your ability to respond, to think, um, to just carry on with your life. And it's important that hypnosis is something you can turn on and you can turn off. And if you numb pain, you numb a lot of, and um, it's also frankly dangerous. Last year, 118,000 Americans died of opioid overdose. That's horrible. That's just horrifying. And it is so much better to have a technique that you can use to make yourself and your body feel more comfortable. That isn't going to kill you, won't get you arrested, and a lot of other things. These drugs, uh, they reduce your ability. They sedate you. They make it hard for you to just do anything. And so you're now fighting, it's like not getting enough sleep. It's like you're, digging your way through a fog and trying to get yourself back to where you want it to be. And you don't need to do that. So, but the way to think of it is when I put this stuff into my kid, my baby, you know, and if you wouldn't, then think, well, your body is as dependent on you as your baby is. And so treat your body with the same respect you treat a little child or a baby, and respect and protect it. And the minute you decide to do that, start feeling better about yourself and you'll function better because you don't have all that stuff in your brain interfering with your ability to do things.
And I think the big problem there is that when someone's brain gets hijacked, their ability to make, rational decisions goes out the window. And, one of the best descriptions I got of how addiction completely revamps your pleasure system is that when, again, I'm a recovering, opioid addict. And so, like, I was told that if you're not a drug addict, the idea of going to a place like the Grand Canyon, like one of the most beautiful sites in the world, is like a 10 out of 10 in pleasure. And then when you give somebody like something like cocaine or Oxycontin, then the idea the pleasureness of the Grand Canyon goes from like a 10 to like an 8 to a 7. The cocaine, the Oxycontin rises and rises. And sure enough, like your idea of pleasure now is kind of upside down. You got doing drugs at a 10, the Grand Canyon at a 1. And so now the brain is completely like flipped on its head. My question to you is how do you get somebody to make better decisions with their life when their brain has been completely hijacked?
Well, it's certainly, you're absolutely right. Your brain has been hijacked. And one thing is to just, if you're appealing to someone to be there, wait till whatever that moment is when they're relatively clean and sober, and then you can talk to them. You're right that when they're high on something, they're not likely to listen very much. Although there are some drugs that people learn from the experience. Some of these uh, well, drugs like psilocybin and ayahuasca and other things, people actually learn things from their drug experience. But at other times, you're just numbed out and you can't respond. And if you know someone like that, you want to help. You want to get them at a moment when they're not high and they can't just blow you off.
My follow-up question to that is for the person that's listening to this or watching this that maybe is in the thick of addiction or in the thick of some unhealthy mental health habits, and they're just trying and trying to make better decisions. How can they create some separation? Is hypnosis the answer when if they're trying to like create some separation to be able to kind of start to tap back into that rational state of mind?
Oh, yeah, I think so, and it's a good example. You say, "Look, when you start coming down or whatever it is." But I'll give you an example with pain. We do a lot of work with pain control with hypnosis, and people get hooked on OxyContin or early drugs like that. So when you're coming off, and if the pain is getting worse, try instead of taking another pill, try doing self-hypnosis. Imagine your body's floating in an icy mountain lake, whirlpooling and tilted your head out of the pain. People can substantially reduce or eliminate pain just with hypnosis. No side effect, no legal problems, no medical problems. You can just learn to do that. And as you're sliding off the drug, slide into something like hypnosis, which can help you take care of the real problem you started the drug to deal with, the pain. And you can actually reduce or eliminate the pain that way.
I'm sure you've had your fair share of anxiety battles and stuff over the years, just like everyone else. Is there a time that comes to mind now in the last few years, last decade, where you've really had to tap in to your own teachings in order to improve your mental health?
Well, sure. From fortunately, I haven't had any like super major problems, but well, I can remember having a horrible flight across the Atlantic and arriving in London with a pounding headache. And I took the one coin I had, the workable machine, and put it in the machine to get some aspirin. And the coin went down, but the aspirin didn't come out. I had to get on a bus, and I'm feeling worse. And I thought, you idiot, this is your day job, do some self. And I don't know who was more surprised, but my headache was gone. Within like 10 minutes, the headache was gone. And I thought, oh yeah, you should remember to do this. I did it once. I was trying to water ski and I kept face planting in the water, and I realized that I was very tense about it. I was worried about it. I wasn't good at it. I wanted to be good at it. And I realized that in my tension, what I was doing was bending my elbows, and trying to sort of resist the pull and keeping my knees straight to sort of resist it. So I was fighting the problem. And I just hypnotized myself and said, arms straight, knees bent, arms straight, knees bent. And as I did that, I was up and water skiing. It's just, I was programming my body to do what it needed to do and not to act out of anxiety, but act out of a plan for what's the best way to absorb the pull, enjoy it.
One of the other traps, I guess you could call it, that people fall into when it comes to anxiety is this level of, I guess you would call it cognitive dissonance, where you have somebody that maybe has lost a job or their relationship has fallen apart or whatever the example is. Their child is incredibly sick, and they're trying anxiety techniques, and yet their life is just not getting better. Like they need money, they want their kid to get healthy, like all these things. How can people deal with that when they're working on calming their anxiety down, but yet like their life as it's showing up is just not getting any better?
Well, I would say that the main thing is to find a way to make the anxiety not be the problem, but what the anxiety is about, which is the problem. So what you need to do in situations like that is, find a way to get the money you need to support your family or get your child the medical care they need. And the anxiety is a signal to you that there's something you need to do to help deal with this problem. And so the trouble with the anxiety is you're just focusing on yourself and what's wrong with you, what's making you uncomfortable. And that's important, but it's not solving the problem. So, what you want to do is say, okay, here's a reason why I'm feeling this anxiety. That's my brain telling me that I better figure out a solution for this problem and focus on what you're for and what you can do to fix it. And sometimes you can. Sometimes you say, okay, I need to tolerate this better, make my body more comfortable in reaction to it. But a lot of the time, say, thanks for the message. I got it. I'm going to do something.
Speaking of like getting outside of yourself and not thinking so much about, your problems in itself, Like, is that why being of service and helping other people is so powerful for the brain, specifically when you're going through hard times?
Absolutely. Absolutely. And I know you've done that. It's an example for you and seeing that they, more than just you and helping other people, you're helping yourself. For decades, I ran support groups for women with metastatic breast cancer. And, it's a serious problem. They were facing a threat to their lives. But you know what? They felt better about themselves because for the first time, for example, in the group, they feel like an expert in dealing with cancer. I've learned stuff that they can help other women dealing with the same problems deal with it better. I had a woman who was all excited because he came back from having had an x-ray, and those x-rays are always very anxiety provoking. Are they going to see new lesions or not? And she said, I found out that you can just ask the x-ray tech to see if he notices anything. And it's not official, but at least it gives you an idea. And I was so much less anxious because I could get a sort of advanced notice of what I was dealing with, and I didn't have to wait a week until the doctor's report. And so she felt good. So she's taking a bad situation. She's got metastatic breast cancer. She's with women with the same disease. He said, I could help them. And that gives you a sense of confidence, and it winds up reducing your own anxiety. And we found when we started these groups, people thought we were going to make them worse, that they were going to see one another dying of the same illness. In fact, they felt better. Their anxiety went down. The more they expressed their feelings, the better they felt. They were helping one another. And one woman said that being in the group is like looking, into the Grand Canyon. You can see that falling down would be a disaster, but you feel better about yourself because you're able to look at it. I can't say I feel serene, but I can look at it. So you're finding something about even a terrible situation that gives you something positive that can come out of it. And that's a good thing. Learn to do that. Find what you can do to help others, and you'll feel better about yourself and your mastery of the problem.
Yeah, it's such a big issue too, because I think when you're in the thick of adversity, it's hard to see the silver lining because you're just narrowly focused on that problem in itself. And it's not until you get on the other side of it years later at times where you're like, oh, like that was the takeaway and the positive thing that came from that. How can people, generally speaking, get better as a whole at navigating that side of things where where they can find silver lining in things when life doesn't seem fair?
Well, I think that's one way in which hypnosis can be helpful. It can be a way in which you can retreat from just the direct conflict with it and say, can I think about this in a different way? And you get your body comfortable floating in a bath or like the hot tub or floating in space. You're already feeling a little more confident in managing your body and how aroused it is. And then you can picture, um, here's the bad thing about this. What's something positive that I learned a lesson I needed to learn? Was I able to help people that before I couldn't help? Um, that you can calm your body enough to allow your mind to examine the problem from a different point of view. And if you can do that, you can start to feel better.
Are people coming to you for hypnosis like after they've tried everything else, or is hypnosis typically like the first thing people try?
No, it's not. I wish it were. No. We have a lot of people that wouldn't be addicted to opioids if they came and learned how to use hypnosis to help themselves deal with their pain, for example. So I tend to be, after 3 or 4 other people they have been seeing, they come to see me. And not always, but often I go to help. Even if they're not that hypnotizable. I had one day, I had a woman who was like 10 out of 10. I mean, just extremely hypnotizable. And her pain, she had pain in her jaw for years. And she said, hey, you're a magician. Well, pain is gone. I can't believe this. And then so I was feeling pretty good. And then I had another guy whose score was 0. It's not even a little, very sort of cranky, rationalist kind of guy, skeptical of everything. And he had injured himself in a work accident and had badly hurt his knee, and he was hurting him forever. And he was getting more and more frustrated, and he'd had surgeries and he had this, and nothing worked. And and he said, and now, the imaging doesn't show anything wrong with the knee anymore. And I said, "You're kind of a perfectionist, aren't you?" And he said, "Yeah, I am." And doctors are telling you they can't find anything all that wrong, but you are kind of a worrier. If there's any possibility something might be wrong, that's it for you. And I think your worry is worse than your pain, frankly. And he said to me, I thought he was going to already say, "What the hell is this? You're supposed to numb my knee." And he said, "You know what? You're the first doctor that's told me that. And I think you're right." So just having a sense of how people handle problems and letting them handle them differently can make a big difference. Because sometimes we amplify our problems rather than hypnosis can be a great way to help people to reduce them.
And speaking of amplifying problems, I think one of the problems that makes things worse, one of the things that can make things worse is trying things over and over again that don't work. Are there methods of solving anxiety? I mean, you've been in the game a really long time. You've been at Stanford. I think I was reading like 50 years, which congrats to you on that. Um, has there been modalities you've seen over the years that just don't work that people continue to invest energy into?
Well, one problem, there are anti-anxiety drugs, benzodiazepines and others that in the short run will numb you out. And sometimes it's a reasonable thing to do. But in the long run, you can get habituated to them and you get a kind of, it's like with opioids too. The symptom is amplified when you're trying to stop the drug, but you get kind of hooked on it because the symptom gets worse than it was when you're trying to withdraw from. And so I think we have been overly reliant on drugs for problems. And I'm a psychiatrist. I'm a doctor. I use medication. Sometimes that's the best thing to do, but not always. And so I start from the presumption that maybe there's a way you can teach your brain to handle this better. And if that doesn't work, we'll do the meds. But I've seen too many people kind of get stuck the other way around and have trouble getting the full benefit that they hope for and getting off the drug.
What about breath work? Do you think that's effective?
I do. We've done a study recently. Foundation Tianren funded us to study breath work, and we studied different kinds of breath work during the COVID pandemic, actually. And we taught people different ways of controlling their breath. And the one that seemed to work the best was cyclic sighing. And it's an exercise where you just inhale through your nose, starting with your abdomen, and fill your chest completely, and slowly exhale through your mouth. And you do that just a few times, and you notice that your body starts to feel better, and you do. And we found in this study, a randomized study, that the ones who did breath work, particularly cyclic sighing, did better than people who did just a very brief meditation session, not long enough to be, acceptable standard meditation. But they felt their mood got better. They felt less anxious, and they actually slowed their average respiratory rate by a breath a minute, which is a big deal, actually, because we tend to over-breathe. And so, yes, we found breath work to be very helpful.
And do you think things like breath work should be done in conjunction with hypnosis, or do you think that people should just pick one practice that can help them with their anxiety?
I think it's fine. I don't think there are any crossover side effects. People want to do both. And I often incorporate some cyclic in my hypnotic induction as well. So, yeah, I think it can be helpful to do both, absolutely.
Well, Dr. Spiegel, this has been an awesome conversation. Is there anything else you'd like to add that we haven't touched on when it comes to reducing anxiety, hypnosis, stress, fear, etc.?
Well, thank you. Well, I just say that, about 5 years ago, probably came up to me at a Brain Mind conference where I was giving a talk, and you mentioned that hypnosis is still under-respected, as you mentioned, and underutilized. But, it helps people. You want to try building an app. And it was when Amazon had Alexa just come out, and they were making it easy to make recordings. They said, "You want me to help you build a little app and see what we could do?" And so I said, "Great, let's do it." And we built a stop smoking app, and we were getting 1 out of 4 people to stop smoking, and the ones who were still smoking cut down by about half. And I thought, hell, that's not bad. So we formed a company, Reverie, Reveri. My legacy project, Doug, is to have as many people as want have access to hypnosis. We used to fear that it would be too difficult or too dangerous to teach people to do it on their own. We now know that that's not the case at all, that people find it helpful. They're reducing their stress. They're reducing anxiety. They're controlling their pain. They're stopping smoking. They're flying on airplanes they couldn't fly on before. And that makes me feel really good. So I invite people to give Reverie a try. The first week is free. See if it helps you. It helps. We've had 1.2 million downloads. So we got a lot of people. I will feel very good. More and more people will have access to and take advantage of the opportunity to train their brain with hypnosis.
Awesome. Well, I highly encourage people to give that a try and check it out. Well, Dr. Spiegel, thank you so much once again for coming on the podcast. I think my audience is going to love this conversation.
I hope so. I hope they're entranced by it. Take care.